what do we do if somebody has the dry eyes? Do we just put in eye drops?
I'd say for most of the time, that's fine. You know, if you were to go into the drugstore, you will see a huge aisle of nothing but drops for dry eyes. It's an extremely common thing. So there's a lot of different products and brands out there. I don't have a strong feeling necessarily what is best. Sometimes it's just trial and error. Some I think do work better than others, but for the most part, it's a trial and error. And for mild signs or symptoms of dryness, an occasional teardrop over the counter is absolutely fine.
So what happens if you're using them all the time? You have to use them 4 or 5 times a day. Because the more I look for it, the more people say, oh, I've got dry eyes, I have to put in eye drops all the time. Where can that be a danger to the person?
So the eye is sometimes associated or susceptible to the actual preservative in the teardrops. So if someone needs to be using drops 4 or 5 times a day, there's a couple of things I would say. Number one, that person needs to be using preservative-free teardrops that come in little tiny vials as opposed to a bottle. And really, if you're needing drops that much, you need to go see an eye doctor.
So when you go see an eye doctor, can you tell what's going on with the meibomian glands? Can you tell what's going on with the eyelids? Can you tell what's going on with the tear gland?
Yes, sir, just by looking. I mean, it's not hard. Any ophthalmologist can just look at your eyes and they can see all those things. You can't really see the lacrimal gland very well, but you can certainly get an idea if it's functioning well or not.